UroPatient. Tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning, everyone. Happy Valentine's Day. I'm your host, Vic Senese, and this is UroPatient. If you're watching us live, be sure to hit that like and subscribe. If you're watching us and you're not live, hit the like and subscribe anyway. Hey, today on UroPatient, I'm tackling a question many men quietly wonder about, but rarely ask out loud. Is circumcision reversal possible? Circumcision is one of the most common surgical procedures performed worldwide. But for some men later in life, questions arise about sensitivity, appearance, body image, or personal identity. Can anything be done? What are the options? And what's realistic versus misinformation online? I'll explore what circumcision reversal actually means, whether true surgical reversal exists, what restoration techniques involve, and what men should understand about safety, expectations, and outcomes. If this topic has ever crossed your mind, or if you're simply curious about the science behind it, stay with me for this fascinating episode. Welcome. Today we're talking openly about circumcision reversal, what it is, what it isn't. If you've ever wondered whether circumcision reversal is possible, what men actually experience, or whether it's right for you, this conversation is about informed choice, not judgment, hype, or false hope. Because when it comes to your body, you deserve the truth. So let's clear this up early. Circumcision reversal usually refers to foreskin restoration, a non-surgical process that helps some circumcised men regain partial coverage of the head of their penis over time. It works by gently stretching the remaining penile skin, encouraging the body to gradually grow more skin through a natural process called tissue expansion. It's important to know that circumcision reversal does not recreate the original foreskin or restore removed nerves. But some men report improved comfort, appearance, or sensitivity. Results vary widely, and the process takes patience, often months to years, and the decision is a very personal one based on individual goals and expectations. So I think it's important to start with, what's a circumcision? What's involved? Because for most of you, it probably happened when you were an infant, so you didn't really get much say or explanation. But a circumcision is a surgical procedure in which the foreskin, the fold of skin covering the head of the penis, is partially or completely removed. Now, this is often done for cultural, religious, or even medical reasons, such as preventing infections or addressing certain urologic conditions. If you're concerned about what the medical reasons might have been, back before there was good hygiene, there was a higher risk of penile cancer in men that were not circumcised. So thus, now in today's generation where hygiene is not an issue, we don't really see that need. So while generally safe, circumcision permanently changes the anatomy of the penis, affecting the appearance, coverage of the glans, and in some cases, sensitivity. Understanding what was removed is important for men considering foreskin restoration or reversal later. So as we can see from these pictures here of the penis, that it's basically cutting off that skin and just reattaching it so that the head of the penis is exposed. That's a circumcision. So why sensitivity can be affected is the foreskin contains some specialized nerve endings and exposes the glans, the head of the penis, which is normally covered, exposes the gland to constant friction and contact. Interestingly, we've done circumcisions to older men who have had to have it done because of a stricture or a narrowing of the foreskin where they couldn't retract it in order to urinate. So the patients have often complained because that head of the penis has been covered for so long that it's really sensitive. I mean, terribly sensitive. Just the rubbing against the underwear and stuff was driving him crazy. I had one patient whose wife actually knitted him a little hoodie to put over the tip of his penis so that he could kind of stand it better. But that just shows you how much the foreskin does as far as protecting the head of the penis and some of those nerve endings. But over time, this exposure, again, from having the glands exposed to surfaces, generally as a child and for most of your life, it can cause it to become less sensitive, the head of the penis, less sensitive, and develop a tougher, less responsive surface. While some men may notice minimal changes, others report a difference in sexual sensation or comfort. It's important to understand that foreskin restoration cannot fully replace the lost nerves, though some men find gradual coverage and protection of the glands can help improve comfort and perception of sensitivity. Another structure that's, I think, important to talk about is the thing called the frenulum. The frenulum is that small little piece of tissue, as I show here in this picture. It's a highly sensitive band of tissue on the underside of the penis that connects the glans, the head to the shaft. It contains many nerve endings and plays an important role in sexual sensation and pleasure. In circumcision, the frenulum may or may not be partially removed. You have to look yourself to see whether you still have a frenulum if you've had a circumcision. That removal could reduce sensitivity in this area. So during foreskin restoration, the frenulum itself cannot be replaced, and those nerve endings, unfortunately. But restoring coverage over the glands may help protect the area and improve overall comfort. Understanding the role of the frenulum helps men set more realistic goals. Again, if you have an intact frenulum, your circumcision was done probably to the best of abilities at the time, then, it should have a minimal effect. But if that's been, removed with the circumcision, it could have a bigger effect. Unfortunately, a permanent effect. Now, I want to be honest with you. This is not true foreskin regeneration. Important truth up front. Circumcision reversal does not restore the penis to its original uncircumcised state. It cannot regrow a natural foreskin, specialized structures, or nerves that were removed during the circumcision. And there are no guaranteed changes in sensation or sexual function. While some men experience increased comfort because of the coverage of the glands, as we talked about earlier, results can vary greatly from person to person. So understand these limits from the start is essential so expectations stay realistic and the decision is based on informed choices, not promises or pressure. Now, why do men consider this? Well, men consider it for all sorts of reasons, and all of them are valid. Men consider circumcision reversal for personal and valid reasons. Some are seeking increased comfort or reduced dryness and irritation, while others hope for changes in sensitivity or a more natural appearance. For many, the motivation is emotional or psychological, wanting a stronger sense of bodily autonomy, healing from feelings about being circumcised without consent, or improving body image and confidence. There's no single right reason, and deciding to explore reversal is often about aligning one's body with one's values of sense of self. So how this restoration works. Now, I mentioned that it's generally not a surgical procedure, but I am going to talk about the surgery that can also be done. But the most common thing is a stretching of the skin. This process relies on the body's natural ability to expand skin slowly. Foreskin restoration works by applying gentle, consistent tension to the remaining penile skin, encouraging the body to slowly create more skin through a natural process called tissue expansion. This is the same biological principle used in other areas of medicine, such as skin expansion for reconstructive surgery. The process is gradual and requires patience, and changes typically occur over months or even years, not weeks. Progress depends on consistent, proper technique and listening to your body to avoid injury or discomfort. Word of warning, foreskin restoration, skin stretching, is not recognized as a standard medical procedure by the AUA guidelines in literature. Did a quick literature check to just see what's going on. AUI is the American Association of Urologists. So anyway, I just wanted to share that with you. Now, other methods used, unlike casual stretching, medical skin stretching uses structured, safe methods designed to apply consistent tension without causing injury. These typically include things like tension devices, small, purpose-built devices that attach to the penile skin to provide continuous, gentle stretching. They're adjustable to maintain safe tension and are designed for long-term use. Tapes or weights, some techniques use adhesive tapes or small weights to pull the skin downward gradually. These methods require careful monitoring to avoid irritation or injury. Warning, don't try this on yourself without the guidance of a professional. We all know that you can go to Google and Google it and find all sorts of exercises out there you can try on your own, and you can find all sorts of devices you can try on your own, but this, could be dangerous if you're not sure what you're doing. So, what might you gain? What's the realistic thing that you should know? Some men report increased comfort or sensitivity, but results are unpredictable. Again, the head of the penis has a lot of the nerves, and being exposed to, your underwear and everything else causes desensitization. So, get it covered again, maybe that'll get back. With foreskin restoration, some men report gains such as increased skin coverage, improved comfort, reduced dryness or irritation of the glands, while other changes in sensitivity, often described as heightened awareness or comfort rather than dramatic increases in sexual sensation. Emotional benefits can also be important, including improved body image, confidence, or a greater sense of control over one's own body. It's important to remember that results vary widely, and not everyone experiences the same physical or emotional outcomes. Now, what you won't be told too often, what isn't often emphasized, is that the foreskin restoration has clear limits. It does not regenerate lost nerves, as I mentioned earlier. Specialized tissue or original foreskin and any changes in sensation are unpredictable. Progress can be slow, sometimes frustratingly slow, and there may be long periods where the changes are subtle or hard to notice. Online stories often highlight best case outcomes. Many men, and we know that social media is terrible at telling the horror story to tell us the best case, but many men experience modest results, making it essential to approach restoration with realistic expectations and patience. Foreskin restoration, generally considered low risk when done carefully, but it's not risk-free. Common issues include skin irritation, soreness, minor injuries from applying too much tension or progressing too quickly. Overstretching can lead to pain, inflammation, or a need to stop altogether for healing. Just as important are the emotional realities. Frustration, impatience, or disappointment can occur if expectations aren't being met, making it essential to move slow, listen to your body, and prioritize both physical and emotional well-being. So let's talk a little bit about the mental and emotional side, because this journey brings up emotions. That's normal. The mental and emotional side of the foreskin restoration is just as important as the physical process. Many men experience a mix of hope and frustration and patience, as progress can be slow and results vary. It's normal to feel discouraged at times, especially if changes are subtle or take longer than expected. Support from trusted friends, partners, or online communities can be some help, and maintaining realistic expectations is key. Approaching the process with self-compassion and understanding make the journey healthier and more sustainable. Now, not everybody should do this. This isn't right for everyone, and that's okay. And if it's not a big issue for you, definitely not something you have to do. Men with active infections, however, skin conditions, or injuries in the genital area should avoid starting restoration until fully healed. It's also not recommended for those with unrealistic expectations about the sensation or appearance or disappointment that can lead to emotional distress. Consulting a healthcare professional before beginning can help identify any physical or medical reasons to delay or avoid the process, ensuring it's safe and appropriate for your individual situation. So I always recommend talk to your healthcare professional. They can set realistic expectations before starting foreskin restoration. It's a good idea to talk with a qualified healthcare professional, somebody who specializes, such as a urologist or a men's health specialist, and provide guidance on safe techniques. In addition, a mental health professional can help set realistic expectations and provide support for emotional aspects of the process. Open conversations with trusted providers ensure you understand both the physical and psychological considerations, helping you make informed decisions and avoid potential risk. Now, I did say I was going to talk a little bit about the surgical procedures. Again, they're not first-line therapy, but they do exist, so I thought it'd be worth talking about. So there is surgical foreskin restoration. In some cases, men may choose a surgical approach to restore foreskin, though it's much less common than non-surgical methods, the stretching we talked about. Surgery can involve using nearby penile skin or grafts from other parts of the body to create a covering over the glands. While it can provide faster and more extensive coverage, surgery carries risks such as scarring, infection, or changes in sensation. And the reconstructed skin will not fully replicate a natural foreskin. Recovery can take weeks and results vary, so it's important to discuss your expectations, potential complications, and alternatives thoroughly with a qualified urologist before deciding on surgery. Finally, there's a great discussion on the latest surgical options by fellow YouTuber Dr. Rena Malik. I encourage you to check out her full episode, and I've got the listing up there on the website, or just go to YouTube and look up Undo Circumcision. And I'm going to show just a short little snip about her research that she did on the surgical option.
However, in 2021, the Indian Journal of Plastic Surgery published their reports on their foreskin restoration surgery on 46 patients. They specifically had patients who wanted to have foreskin restoration, most commonly for religious reasons. They also didn't want it to be visible even when it was erect. And they also didn't want to have any visualization of any sort of penile scar that it would make it obvious that they had surgery. And what they did essentially is they took off all the skin, not just on the shaft of the penis, but also on the glands of the penis. They then, after taking all of this off, they extended the foreskin above the glands and then rolled it over so that they could suture it down to the pee hole and make it look like the glands was completely covered by foreskin. And they followed these patients for quite a long period of time. Again, this is a very small subset of patients, but they followed these patients, at least 37 of them, for up to almost 2 years. That's pretty impressive. And out of those 37 that were followed up, again, 9 of them were lost to follow up, so we don't really know exactly what happened after the first 3 months. Maybe they had bad outcomes, but out of those 37, only 1 had a failure. There was really no evidence of other issues like infections or either of the urine or of the foreskin. And they had normal erections that were painless and not affected by the procedure itself. So that's the most up-to-date surgical literature on foreskin restoration.
All right, so there you have it. Everything you needed to know about circumcision, or circumcision reversal, but we're afraid to ask. So it's out there, folks. We don't see a lot of it done, but anyway, I did get a question and some comments that came in through the comment area. Somebody was asking why we're talking about this, and actually, patients had written in to me, several of them, about circumcision and circumcision reversal. So I thought it'd be a good one to cover. And I did see one question here that came through I did want to address. And Heather said, can girls get cancer in the vagina? And absolutely, that is a risk. So just so you know that. Urology doesn't tend to be too involved, except sometimes we'll note it when we are doing exams, but it's more gynecological cancer, so it's covered by your gynecologist. So make sure you get your regular visits. So hopefully you learned a few things about circumcisions that you didn't know about and how you can reverse them if it's a big issue for you. Again, there's a lot of controversy out there too, that people wonder, why we do circumcisions, and is it right to do circumcisions because it's done when you're too young to really, consent to it. But, some of it's just things that are kind of been done over time, and your dad was circumcised, he circumcised the kids, etc. And it goes on, but there's really no need for it anymore, as I mentioned. So with that, I'll hope to see everybody next week for more on UroPatient. And my name is Vic Senese, and tune in next week for UroPatient.
From research